So you are a neurosurgeon.
I
If,
am a nurse, yes.
how many years have you been practicing?
Um, I've been out of residency practicing now for probably 24 years, quite a while.
How many total years of schooling did you have?
So you have to do 4 years of college, so it's 4 years, then 4 years of medical school. Then I did a Howard Hughes Research Fellowship, which was an extra year, and then 7 years of residency. So that would be what, eight, 15, 15 years after high school. I was an old man by the time I got out.
Yeah. Where did you go to undergrad?
University of Toledo here in Toledo, Ohio.
And what was your major in undergrad?
It was Bachelor of Arts, actually, just a BA. I think
Okay.
most people did a BS at that time, Bachelor of Science. I did a BA, but it didn't matter.
Where did you attend medical school?
Medical College of Ohio, which is also here in Toledo, Ohio.
Where did you have your residency?
So I did residency in Rochester, New York, at the University of what was called Strong Memorial Hospital, University of Rochester.
And then you said you did you complete a fellowship after residency, or you did your research one?
No, this was a research year before I did. So it was a Howard Hughes Research Fellowship. They gave out like 60 in the country. So it's pretty coveted. So I did that for a year, and that was before residency.
Perfect. And then did you do one after residency?
No, no, I did not.
What made you decide to go into medicine?
Um, you want to hear the story? So what had happened is I was actually signed up to go into marine biology,
Hmm.
and I was signed up at the University of South Florida to start marine biology. And my brother was in a car accident, and he was life flighted in the middle of the night to hospital here in Toledo at Medical College of Ohio, and he needed emergency brain surgery that night. And then he was in the ICU, and I was actually living in Florida at the time, so I flew up back to Toledo and saw my brother in the ICU. You know, he had tubes coming out of his head, his chest. I mean, his face was swollen. You didn't even hardly recognize him. But he was in the ICU for about 2 to 3 weeks, and I got to hang around that environment. I met the neurosurgeon. I really got interested in neurosurgery. And then Eric eventually, he was in a coma for 6 months. He woke up from his coma and ended up going into a nursing home. But um, so that was my initial reason why I wanted to go into medicine. I wanted to be a neurosurgeon because of what happened to my brother. So I dropped out of my classes at South Florida in marine biology, and I moved back to Toledo, Ohio, and I started at the University of Toledo to become a neurosurgeon. And then I did my 4 years of college. And then in my second year of medical school, my mom one morning, she couldn't write. She told me she just couldn't write her letters. She loved to like write letters to people, and she couldn't use her hand properly. And I could see something was wrong. So I went and talked to the neurosurgeon that I knew. He was the same neurosurgeon that operated my brother years ago. And I told him about my mom. And he had my mom come in, and he did a CAT scan, and she had like 7 tumors in her brain.
Wow.
And so my mom, she had 2 brain surgeries. I went through chemotherapy, radiation therapy, all her hair fell out. I mean, it was a miserable existence. And from the time she was diagnosed to the time she died was just 3 months. 3 months later, she died. And that really, really impacted me. And I knew neurosurgery was what I needed to do and I wanted to do. And it taught me a lot about, not always pushing so hard to rush people to surgery and put them through everything, because look at my mom, we put her through all that stuff and she still died 3 months later. So anyways, I learned a lot to that experience. And then I just, after medical school, I went to residency and became a neurosurgeon.
Sorry to hear that, but yeah, that
Uh, there was
definitely
a,
is a good reason.
yeah.
Uh, so then obviously, like going like the first day of medical school, you were pretty set on neurosurgery then.
I was, I mean, as you go through it, like some of the services I went through once you get in your third and fourth year when you rotate, there were a couple other services I liked. I mean, I thought internal medicine was cool.
Mhm.
You're kind of like an investigator trying to figure out a diagnosis. I definitely didn't like OB delivering babies. I definitely didn't like psychiatry. Plastic surgery, I did a rotation of plastic surgery. It was kind of cool too. But neurosurgery is what I just gravitated towards. That's what I wanted to do.
Makes sense.
Yeah.
Is neurosurgery, is it DO or MD dominant?
I think it's MD dominant for sure, but there's certainly some DOs. And I don't know exactly the difference. So I can't really tell you, but
No, all good. And then what hospital do you work at currently?
so currently I work at St. Luke's Hospital, which is McLaren St. Luke's here in Toledo.
Got it. Have you worked at Toledo at all, or?
I have. So when I first moved to town, I worked predominantly in the Mercy system, and I was there for 4 or 5 years with a group. And after about 4 or 5 years, I ended up leaving that group, and I went to the Toledo Clinic. And then we predominantly operated out of Toledo Hospital and took their level 1 trauma for them. And I was there for 16 years. Our affiliation with them ended about 3 or 4 years ago, and then now I've been at McLaren St. Luke's. But yeah, I was at Toledo Hospital probably most of my career in Toledo.
Do you work with residents at St. Luke's at all, or?
No, no, and we didn't really. I mean, honestly, so at Mercy System, when I first started out, they had a big ER program, and so we would have the ER residents rotate on neurosurgery. So I worked a lot with residents when I first started in the practice 24 years ago, and then at Toledo Hospital, every once in a while, you might have a resident come through your service, but not much. So not really.
What would you say is the most unique part of your specialty?
What's the most unique part? I mean, I think it's not like the anatomy or the surgery. It's more about just helping people, like how you can change people's lives. Like recently, I had a guy come in that I did emergency surgery on him. He couldn't really hardly move his legs, and I took him to surgery, and now he can move his legs again. So, I mean, it's that kind of stuff that you can't put a price on or value on. I remember one guy I operated on. He's an old guy in his 80s, and he came into the hospital. It was elective surgery, but he came in. He's in a wheelchair. He hadn't walked for probably 3 months, and he just couldn't walk anymore. He had so much pain in his legs, and so I operated on him. Surgery went well. He had narrowing of his spinal canal. I come in the next morning. He's not in his bed, and I really was scared. I thought, did he die or something bad happened overnight? And so I found the nurses, and so he's out walking in the halls. So I had him come back into the room and was talking to him. He goes, today's my birthday. He said, you gave me my best birthday I've ever had in my 85 years of life. He said, I can walk again. I mean, I just can't replace that. Or, I put out a few videos on TikTok recently, and one of them was about epidural hematomas. And I've had several people respond saying, you operated on my child when they were younger and saved their life. And, it's the kind of stuff that it just makes it all worthwhile. And that's what I think is the best thing about neurosurgery.
Definitely.
Yeah.
Why should someone choose your specialty?
Well, I think you have to be interested in the brain and nervous system, first of all. And for me, it was the most challenging. I thought it was the most challenging, skillful field there was. I mean, I'm sure other doctors might disagree, but from my perspective, I thought neurosurgery was just the top of the top. I thought it was very challenging. It was a lot of life and death stuff, which it is. And so those are things that you have to be ready to accept. I mean, there are times that it's nerve-wracking and somebody's life is in your hands, and you got to be from the get-go knowing you're going to be in those situations someday if you become a neurosurgeon. So those are things you have to consider. Did I get off topic? What was the question?
No, not at all. No.
Okay.
Why should someone not go into your specialty?
Well, if somebody doesn't like to work long hours, they don't like to be up potentially in the middle of the night, if they don't like to don't want to do surgery, I mean, those would be reasons not to go into it. I mean, the blood thing, I mean, everybody gets used to it. When you first see blood for the first time in a real person, you might get lightheaded and stuff, but I mean, that becomes very normal. So it's not anything like that. It would have to be work ethic. You don't want to work long hours. You want to have a family where you can be home all the time, which as a neurosurgeon, you're not going to be home all the time.
Yeah. What does an average day look like for you?
I mean, average day nowadays is different than how it used to be a while back. I mean, now I like tomorrow I have 3 surgeries, so I'm on call, so I'll go in the hospital, probably get there around 6 or 6:30, and then see my patient for surgery. So I usually go to the hospital, round on my patients that are in the hospital. Then I'll go see my patient and I'm going to operate on, talk to them, do the orders, things like that. Then surgery usually starts at 7:30. I have 3 surgeries, and I'll probably be done by mid-afternoon. And then I'm on call. If there's any consults, I'll go see the consults. And then when I'm done with consults,
Mm.
then I'll go home. But days now for me, I don't do as many surgeries as I used to. When we were at Toledo Hospital and I was on trauma call, I mean, routinely asked my kids, I mean, I'd be gone at 4:30 in the morning. I wouldn't be home till 7 or 8 at night. And then when I was on call every third night, I mean, if you had traumas, you can be up all night operating literally through the whole night. And then you go do your full day of surgeries the next day. So sometimes I wouldn't come home till 8 o'clock the following day. And it's exhausting, but you see a lot of stuff, you help a lot of people, but it's just different. I don't do level 1 trauma anymore. So I'm not in the hospital all the time, constantly. I'm not getting up at night all the time.
Makes sense.
And I'm 58 years old, so I'm good with that.
Yeah. How many patients do you see on an average day?
Yeah, so in the past, when we were super busy, I'd see like 50 patients in office in a day, which is a lot. Like today, I saw 24, I think, and I was done around 1:30, 2 o'clock in office. So, but it's still a lot. I mean, you have to spend time. I had like 7 or 8 new patients, and you got to spend time with them. And a lot, 3 or 4 of them needed surgery, so you got to spend your time. But that's an average office for me now, probably anywhere between, I'd say, 24 to 33 patients, something like that.
Definitely. What would you say is the hardest procedure you've done or like currently do?
Well, I mean, the hardest procedure I've ever done, I would say, would probably be, it was a pediatric case with a child who had a deep brain tumor almost in the center of the brain, and just the approach was very hard to get to. Is very dangerous. A lot of important structures. If you nailed one of those veins or arteries or something, you can just put them into a coma or they die. So that was. I remember sitting in that surgery and thinking, there's just nobody can pay me enough to say that I make too much to do this kind of surgery, because I just literally had that kid's life in my hands. But
Yeah.
Deep tumors in the brain are probably the hardest things, I think. I think the most dangerous surgeries, honestly, are people where you have a normal person who's young and you do neck surgery. There's always a risk of paralyzing them, and I think that's the most dangerous, because you could take a young person who's normal and paralyze them. But sheer difficulty in hours would be a deep brain tumor, a complex deep brain tumor. Nowadays I don't do a lot of brain tumors anymore. I mean, simple ones that come in, I do a lot of spine surgery, and things like that. But just over the years, I mean, I've just slowed down a little bit. It's just, I did all that stuff when I was younger for a long, long time, and
Yeah.
gradually drift away from it.
So are you usually not working on or working with pediatric cases? Or you?
No, the last 3 years our hospital doesn't do pediatrics, so I don't do pediatrics anymore. Just because it's not at our hospital. It's not.
Makes sense. What's the most common procedure you do?
Spine surgery. So it'd be a laminectomy, or it'd be a lower back fusion or a neck fusion.
What is the most memorable case you've encountered so far?
I mean, there's so many of them. I mean, I have a person a long time ago. This was, she came in when I was on call, and she was paralyzed almost on her one side, couldn't move her arm or leg. Her speech was really off. And we got a CAT scan and then an MRI of her brain, and she had this enormous, giant brain tumor that looked to me malignant. And I talked to she and her family, and I said, you got to have surgery right away to try to take the pressure off and get a diagnosis. And I told them it was malignant. I said, it looks like a malignant tumor. And so when I got in there, I mean, the tumor really, it's like I got in there and the tumor really had a nice plane between the normal brain, and it came out really nice. And the next day when I came in the morning, and she was moving her arm and leg and her speech was back to normal, and she made a completely normal, well, really, when she left the hospital, she was nearly completely normal. And the pathology came back as a benign pilocytic astrocytoma, which is a benign tumor, and the treatment really is taking it out. So that's one of those cases where I really thought she probably had 3 months to live or less. I thought it was a big malignant brain tumor. It turned out completely benign tumor. Surgery went great, and she went on with life. And there's been so many cases like, people who come with ruptured aneurysm. I remember a teacher that came in with a ruptured brain aneurysm, and 15-20% of the people die on the spot when they rupture an aneurysm, but up to 50% of people die when they have that. So I'd
Mhm.
taken her to surgery and did her surgery for an aneurysm and clipped it. And she came in, semi-comatose. I mean, it was really bad. Just on her way out. And 6 months later, she was back to teach her normal job, teaching kids normal. So just things like that. Or I remember a priest once that was in the emergency department. I got consulted. He became acutely unresponsive
Mhm.
and it was in a coma. And I told the family, I don't think there's anything I can do. We got a CAT scan. He had a huge blood clot over his brain. And the family, he was older, and the family really wanted him to go to surgery. And I gave him no hope that he would ever recover. But I took the blood clot off, and I got him down there immediately. Took the blood clot off. He made a complete recovery and was completely normal. So that's when I learned I don't always know everything either. I mean,
Yeah,
I was definitely wrong on that one, and surgery was the right thing. And I don't know how many years he went on to live, but he made a full recovery.
definitely. So, do you ever have like a challenging time determining like what's a tumor and what's like normal brain or
I mean, during surgery you can, so that's where you got to use common sense. So that's one of my big pet peeves is, you're when you're doing surgery, it's not a mission to take all the tumor out. You got to respect the patient. So if I take somebody and I go in and get, you know, 85% of a tumor and they're normal, I think that's better than getting 95% of the tumor and paralyzing them. So
yeah, definitely.
um, times it's very hard to see. It's easy to get into the center of a tumor and see the abnormal tissue, but when you get out towards the outside of the tumor where it meets normal brain, you can't always differentiate really well what's normal brain and what's tumor. And if you get into an area that's sensitive and you start taking normal brain accidentally, you can hurt somebody. And so I always want people to look the same or better when they come back from surgery, out of surgery. So I always talk to families and the patients about, my goal is to take out as much as I can of this tumor, but safely. Malignant
Mhm.
tumors, you're never going to get all the tumor out. So what's the difference between getting, 2 or 3 more% if you're going to hurt somebody? So,
Definitely.
but it
There's,
is hard sometimes to
yeah,
tell the difference.
I'm sure. Uh, are those the type of procedures where somebody may be awake? I know, like,
Yeah. So, I mean, in residency, we did a lot of awake surgery. And what you're doing is you have to preserve the areas that are important, like the speech centers or the centers for your movement. And so what you do is you actually put somebody to sleep. You open make a scalp incision. You open the skull, get the brain exposed, and then you let them wake up. And you've numbed all the areas that could hurt. So the
yeah.
brain doesn't pain centers, but everything around it does. So once you've numbed everything up, you get everything exposed and the brain exposed, then you wake the patient up. And then we have little electrodes that we stimulate the brain with. And so you'll stimulate an area of the brain and you'll have the patient talking. If they stop talking, then you stop stimulating. And then if they start talking, then you re-stimulate and they stop talking again, then that's an important spot. And
Hmm.
you can't resect it. And then you put a little marker on it and you move to another area. Or you can stimulate the brain and watch the fingers move or arm move or leg move. And then that's an important part of the brain that you can't resect. So it's just a way at surgery to know what you can resect safely and what you can't resect so you don't end up causing a deficit in a person.
Definitely.
So that's what it's used for.
Um, what would you say is the toughest part of your job?
Um, Toughest part of the job, I don't know. I think it's maintaining your composure. Like things can go bad at surgery sometimes. You can get into bleeding you're not expecting or just anatomy you're not expecting. And you have to just stay really level-headed, really calm, and you just got to work your way through it, slowly. And I think that's probably the toughest part is, not trying to have a knee-jerk reaction to just react too quickly. You got to really think about what you're doing, take your time. Even if there's bleeding, let it bleed till you figure out how you're going to approach this properly. So it's keeping a level head, I think, is probably the toughest thing. And then second toughest would probably be deciding who needs surgery and who doesn't. I mean, surgery's hard to do, you're right, but you got to
Mhm.
know who really needs it too. So differentiating someone who needs surgery or doesn't need surgery or has some other problem that you've overlooked, that's probably the second toughest thing.
Definitely. Um, how many hours do you work on an average week?
Mm. On an average week, I would say probably between, I don't know, 50 to 60 hours. Not like the old days, but still a fair amount.
How does that compare to when you were in residency?
Well, in residency, it was crazy. I mean, we were crazy hours. So one week I worked 140 hours, and that's for real.
Jeez.
But that's because I was on call every other night, and even the nights you're on call, you got no sleep. I get 1 or 2 hours of sleep because you're still in the hospital. So, but I mean, when we were residents, we would work long, long hours. Many times 80, 90, and over 100 hours, and that was just routine. But when I trained, there were no laws. Now they have this 80 an hour a week law that you can't work over 80 hours a week, and I don't know how strictly they adhere to that, but it was nothing like that when we trained. But it's fun. I mean, our attendings were great. The residents, we had fun with each other. We worked hard. When we got our work done, we could leave. But I mean, it went fast.
Yeah. Uh, and then I know you said you take call, so how does like your call schedule work for you?
So it's every third night. So I was just on call this weekend, and I'm off today, and then I'll be on call tomorrow, and I'm
Mhm.
on call Thursday. So we usually do. There's three of us, so we take about 10 calls each a month. And when you're on call, you just got to be available. If somebody needs to be seen quickly, you got to go in quickly. If it can wait till the next day, you see them the next day.
Definitely. And how long? I mean, I know I used to live on inlands with you as well, but how long does it usually take you to get to the hospital?
20 minutes.
20 minutes.
I mean, if there's a traffic jam, it'll take longer, but about 20 minutes
Got it. How long does it take for you to chart at the end of the day?
to chart.
Yeah.
0. I do all my stuff like in between cases. I do all my orders, all my charting, and my last surgery I'll do will be do my dictation, get all the paperwork done, and then if there's a console, I'll go do the console and dictate it. But I don't like to leave stuff laying around. Like in office, I dictate after every patient. So when I'm done, I don't save dictations for the later in the day. I'll forget what I saw them for. So after every patient I see in office, I do a dictation so it's fresh in my mind. So I don't have to do any charting work when I'm done. I'm done.
Makes sense. Have you ever worked with a scribe?
Once or twice, I didn't really like it because
Mhm.
um, they just can't get the flavor that I can. Like when I put stuff in
Yeah.
my notes, really for me, it's so I can remind myself when I'm at surgery reading my note, I'll know exactly what I was thinking when I saw that patient. It's very important to know that when if a scribe did it, they're not me. They
Yeah.
won't put stuff in like I will because there's little things I put in my notes that jog my memory about what I'm thinking.
Makes sense. Um, were there any times you didn't think you'd make it as a doctor?
Yeah, I did TikTok on this. I mean, I there's a couple times I think when I was thinking about going into neurosurgery that I was kind of scared. It's a scary proposition to think what you're going to be doing and operating on people's brains and lives. And so I think there was time that everybody has a doubt. If you didn't have a
Mhm.
doubt, I'd say you're kind of odd, because you don't want to be arrogant. You want to be confident, but not arrogant. So there's a few times I doubted it, but I just kind of put it out of my mind. I knew that's what I wanted to do. And you just stick to your guns, persevere, and you do it. So there's not a time that I ever wanted to quit or drop out, nothing like that. But is there a time I questioned, God, am I really going to make it through here for a moment or two? But then you just put it out of your mind. I mean,
Um, what could a medical student do right now to help prepare to go into your specialty?
a medical student. Well, I think the things that kind of what I did is try to get to know one of the neurosurgeons. So biggest thing is you want to get some experience. So get to know your neurosurgeons at your hospital. Try to do some research for them. I did research. I got a few publications in medical school before I went into residency. That really helps you get into residency.
Mhm.
Getting good letter recommendations from neurosurgeons is very, very helpful. Um, when I was trying to um, get into medical school, I became a diener, autopsy assistant. So I did autopsies. It was low pay, but anything you can do in the medical field to show people that you're interested in the field that you want to go into is going to be helpful. So you got to do things like that, um, and read a lot. Read up on neurosurgery. When you're on your neurosurgery rotation, make sure show a lot of initiative, interest. You want to be well read. They ask you questions. Make sure you know about the diseases or at least read about them
Mhm.
so you know about them the next day. All that stuff will help get you a good letter of recommendation. And
Yeah.
then lastly, I mean, you want to get good grades, right? And it still matters. You got to get good grades.
Definitely. Yeah. How often do you need to complete like the continuing medical education seminars?
Um, so continuing medical education is something that's an ongoing thing. The hospital has their version of it that we need to do, and then our neurosurgery society mandates that we get so many, continuing medical education credits every year. So it's kind of all set up for you. You just have to follow the guidelines and make sure you hit your credits that you need.
Okay, so I have a that was like the end, like the very serious, I guess, questions. I have a couple more like fun questions, I guess. Or I guess less serious. So what's like the most amount of patients you've ever seen in a day?
In a day, like in office.
Sure. I guess office and or surgery.
Well, I mean, so office is usually office. So in office, I think I saw up to 55 patients in a day, which is insanity. But
Yeah.
um, as far as surgeries, the most surgeries I've done in a day is probably like around 8 or 9. Because, you know, when I was on level and trauma call, so sometimes we would do up to 7 surgeries a day.
Mhm.
So there was a day where I had like 6 surgeries, and then I was on call, and multiple traumas came in, but 2 of them need to go to surgery. So I stayed up all night and operated on those cases. And so, I think it turned into like 8 or 9 surgeries. And then maybe the next day I operated, but I don't count those as that's another day.
Makes
But
sense.
price, 8 to 9 surgeries.
Would you consider yourself an introvert or extrovert?
I mean, more of an introvert. I my wife's definitely extrovert. I'm more of an introvert. Yeah.
Yeah. Do you think that played a factor in choosing neurosurgery at all? Or
Yeah. Good point. Um, it may have. I mean, I don't know. I've always been more intense, focused. Don't let loose as much, maybe, if people would use that term. So yeah. I mean, there's definitely a personality. I think to be in neurosurgery, you have to have some type of personality.
Mhm.
I don't know if it's type A or what they call it, but you gotta be a little bit intense. I mean, you have to, when you're working on somebody's brain, over somebody's spinal cord. I mean, you got to be a little intense and focused, and you can't be screwing around. And it's
Yeah.
not, it's not like that. There's not a lot of room for mistakes. And that's kind of like a serious question.
Uh, is there a different specialty you think you could have done?
Yeah, I mean, I definitely think I could have done plastic surgery. Um, I had thought about it. Plastic surgery is cool. Like, you can do a lot of reconstructive stuff for kids. Like, I remember when I was doing a rotation plastic surgeon. I remember the old plastic surgeon. This person didn't have an ear. I think it
Mhm.
was burned off in a fire. And he sat there right at surgery, and he sat there and carved a new ear for this person and then attached it. And I'm thinking, that is just so cool. So, I mean,
Wow.
there's a lot of reconstructive things that you can do for people who have cleft palates and all kind of deformities. And then there's stuff where they do cosmetic and boob jobs and stuff. And that kind of stuff didn't intrigue me as much. Um, so I thought about it for a moment, but really neurosurgery, I just think it was more life and death and helping people. And I don't know, that was more challenging, I guess.
I get that. How familiar are you with other neurosurgeons in the area?
Pretty familiar. I know most of the neurosurgeons. I know all of them here in Toledo, but my best buddies with them, no. But I mean, I know all of them.
Got it. I know I shadowed around a little bit.
Uh,
Um, like my stepmom's a CRNA at Blanchard Valley, and I was like working with Dr. Hollis, if you know who that is.
no, yeah, I don't know him.
Okay.
Is he a neurosurgeon there?
Yeah. I
Yeah.
was curious. It's like him and Dr. Renard, I guess shadowed quite a bit. So I was curious if you knew.
Oh, Dr. Renard at Toledo.
Yeah, yeah.
Yeah, I'm sure that's probably an interesting experience. Well, he's super busy, isn't he?
Yeah, very, very. That's why when you said you had 50 patients in an office, like I think when I shadowed him in the office, it was like 30 something patients, and it was a lot to take in. So
No, it is. Office. I'm pretty good at office. I mean, I've always been able to get to the point with people and not
yeah,
make them feel rushed. But it was long hours. I mean, I'd go from
yeah,
8 to 6 o'clock sometimes. So.
definitely. Okay, these ones are definitely a lot more serious, but how did you get into posting on social media?
How to get into posting. So I make videos for my patients. So if somebody's going to have a surgery like today, somebody who was going to have a surgery, they were going to have a neck surgery, and you know she couldn't remember hardly anything. She said, "How am I going to remember all this?" Because it's a lot to go over in the office, and it's all new to them. It's very scary, and I think a lot of people are thinking about their job and their dogs and what am I going to do, and so they're not really focusing. So I learned that really quickly. So I make videos for my patients that are focused to what she came in for. So I have a video of me talking about her condition specifically and her surgery specifically. And in the video, I review an MRI that's similar to hers, and I explain the surgery in detail using a model, exactly what she's going to have. And then when she goes home, or he, they can talk to their family, and they have a video that they can watch over and over, that explains everything I explained in the office. So my son Kevin got involved with that process and was helping me with it. And just recently, about 7 months ago, he said, I wonder what the interest would be in neurosurgery just in the public, because he said your patients love the videos, they just love them to death. And so we tried posting some stuff about neurosurgery on TikTok, and I mean, within like 2 weeks, I had 100,000 followers. It was like crazy, and people were super interested in it. So that's how it all started, and then we realized that there was an interest. So we don't do a ton of videos. Like I don't do dancing. A lot of these people
Yeah,
dance and they sing and all stuff and nonsense, and not nonsense to them, but for me, that's not what I'm going to do. So I try to put out something somewhat educational. Sometimes it has some humor, but most of the stuff I'm trying to do is to be educational, to show people a side of nursery that maybe they never see. We've also started on YouTube now, and that's caught on. So that's how it all started.
definitely.
But I don't see it ending yet anytime soon because it's really building.
How often do you try to post on social media?
Yeah. So I think there for a while, I was like every 2 or 3 days I was doing something. Sometimes I go a week or two without doing it. But I think we're trying to be a little more committed. So I'm going to try to do like one video every 1 to 2 days is what we're trying to do, which is hard. I don't want to make up nonsense stuff either, but um,
Yep.
like the other day, we were supposed to run a 5K, my son and I had to go in for surgery, so I missed the 5K. So, I did a little video about that, and Kevin did his video at the run, and just stuff like that. And it was showed people how life, I miss a lot of my family events, and that was just showing them how neurosurgeon's life is.
I'm sure. Um, who films most of your social media posts?
Either me or my son Kevin. Sometimes Christy, my daughter, helps out too. So we don't do we just use our iPhones and do it very quickly. We don't set up scenes or lighting or any nonsense like that. So I just try to do something that's decent. Like it'd be something like right here, like we're talking now, I just put the phone and maybe talk about something.
Definitely. What have been some of your favorite videos to make?
Well, the one about drinking at the party was my biggest one. I had 18.5
Yeah.
million views. That really went around the world. I mean,
Um,
I had was contacted by Dr. Phil's show, and just newspapers around the world contacted me and news outlets. So that's a big one. But I like that one because I was trying to be lighthearted, and I'm not trying to tell everybody not to drink. I was just trying to teach them how alcohol is metabolized and how much it can build up in your system. So that one I think I liked because it was fun, and yet it turned out to be very educational. And then the other day I did one about drinking alcohol and to show how quickly you get drunk, and it was me actually drinking. And I mean that was a good one because I think it shows people that you're drunk before you hit the 0.8 limit. I mean it just happened. So I think people, it's going to be eye opening. And then I don't know, there's some fun ones like I just had a grandchild, Archie, and so we've done a few videos with Archie, and he was always staring at the ceiling, and I don't remember my kids doing that, but then I researched it, and it's normal for kids to stare at the ceiling. So we did a video on it, and that got like 1.2 million views, but it a lot of parents were glad to hear it because that it's normal, because they were worried something's wrong with their kid.
yeah, definitely.
So,
That's crazy. Wow. Yeah, that's all the questions I have for you. So
okay.
thank you.
Yeah, oh, you're welcome. So what's going so you moved when you moved, did you go, like, how long you been in college? What year are you in?
So I'm a freshman.
Freshman? Okay. And where'd you finish up high school then?
So I stayed at Ottawa Hills. We just bounced around
Okay.
the village. So once we left the, I guess like the house kind of near yours in the Jindals,
Yeah.
my mom moved next to Mancy's on Brookside.
Uh-huh.
And then my dad's been bouncing around and then he ended up right behind Sakura.
Hmm.
So in Northview District, but it was
And
like a
then,
little bit of commute. But it was
so then you're a freshman at Michigan State.
yeah.
And then what's your major?
So I'm currently a biochem major.
Uh-huh.
I've done most of my prereqs, but it's like the same what I'm doing now. Like I could change between like chemistry, bio. So
Huh? What do you want to go into?
neurosurgery. Uh,
Oh, do you?
so
Cool.
that's I was like I knew uh Dr.
I didn't
Renard.
know. I didn't know you didn't say anything. So.
Yeah, I know Dr. Renard pretty well, and I could have interviewed him, but I know you had a nice little social media presence that I'd love to ask you about. So
Yeah. I mean, Renard's pretty cool. He just does, he's in a stage of his life. He does a lot of complex things, and I think he enjoys doing that. And when I was younger, I did a lot of that too. But he's at that level where he does a lot of surgeries. He's a busy guy, so he'd be
mhm,
interesting to talk to. I'm sure he can tell you about some really cool cases.
definitely.
Um, well, yeah, that's cool. So, where do you think you might want to go to medical school then? Have you thought about it, or
I would honestly love to go to Toledo. Just
yeah,
it's near home. Obviously, I don't think I'd live at home, but I guess
yeah?
like being close to family. So
And it depends. It depends what you want to be. Like when I was younger, when I first went in neurosurgery, I wanted to be a chairman of a program. I mean, 100% that's what I wanted to do. I just wanted to be the chairman, train people, really wanted to be academic. Um, and that's just what I wanted to do. And then, as I went through residency and saw how busy we were, and then I was married and then we had 3 kids during residency. And I realized I just didn't want to be away from home all the time, just all the time. So it changed my viewpoints on things. And so then I went into, private practice instead of academics. But that's what I really wanted to do. But it'll be interesting to see as you go through this process how you feel about that. Because I interviewed at all the big top schools like University of Michigan and John Hopkins and Wash U and Yale. And
mhm,
so, but it's I wanted to go to one of those programs so I could get a really be, have a really big name so I could become a chairman somewhere. And it's funny how life changes you. It's just you'll get in and you'll decide what you want to do as you go through it. But the first thing to do is really that's part of why I did the Howard Hughes Research Fellowship too, because it gave me an added step up to get into a really good program,
yeah,
because you got to differentiate yourself from other people. Like
mhm,
everybody has good grades, right?
yeah,
But you got to have something that defines you. Like, why are they going to take you over the other guy that's got a 4.0?
yeah,
But certainly in college, you got to get really good grades. When you go into medical school, it's all about your GPA and your MCAT scores. I mean,
yeah.
if you don't make it into that pile, you're not even going to get into a good program and or get into medical school. So you really need to focus on grades. And then once you get into medical school, then you got to get good grades, but then you got to do some other things that's going to differentiate you, so when you do apply to residency, you have some stuff on your resume.
Makes
Yeah,
sense.
that's
Definitely.
cool.
That's good advice.
But you got to just commit
Yeah,
like I did. I mean, I decided I wanted to be a neurosurgeon. I never wavered. I just you just got to decide that's what you want to do and then stick with it, because you can't be second guess yourself. Especially you can't second guess you want to go into medicine, but then even when it comes to neurosurgery, you just can't second guess yourself. You just got to have your confidence, say, I can do this. This is what I want to do, and just move forward. That'd be my advice too.
perfect. Thank